So principles of neuroplasticity, one way to upweight that neuroplasticity and the ability of the brain's ability to cortically remap. Because remember, with concussion, right, most of the time it is a functional injury. We would see it on functional MRI, which is not what a routine diagnostic. Structurally, we don't see anything potentially. And so we need to kind of get that like ramping up. And what helps that with the cortical remapping is something called brain-derived neurotrophic factor, or BDNF. So aerobic activity, increasing the heart rate, is what produces that. It circulates around the brain, and then I always start with something. Sometimes it's treadmill, sometimes it's bike, sometimes it's cross trainers, sometimes it is just starting with some shuttle drills or some high knees or some whatever is specific to that patient that they want to be able to get back to do is what I choose. Sometimes it's the agility ladder, sometimes, and so we start with that. And then after that, I will target cervical, ocular, vestibular, dual tasking, and then function. But I always start with that. Sometimes it's like walking kettlebell carries down the hall, like whatever they need to be able to do, whatever, if their team's working out and they're doing, weights that day and they feel like they're missing out because they can't do it, then I'll incorporate something with weights as well too, so that they kind of feel like they're still part of getting what they need. So that is patient specific.